Ladies and gentlemen and fellow citizens, welcome to UMedTV. I'm Kemal Erkan, your host. Today is our 14th episode of our political series with Kemal Erkan. Joining me is a remarkable individual with a passion for public service and a vision for better Delaware. Please welcome the distinguished Bethany Hall-Long, who's not only our guest today, but also running for our state's governor position. As we engage an insightful discussion, let's also consider the future we want for our state. Now, I believe Lieutenant Governor just joined me.
Hello, hi, great to be with you today. Thank you for having me.
Hi, Bethany, how are you doing?
I am doing very well. Thank you so much. It's always a pleasure to join you.
Well, it's our pleasure, and thank you again. So we are going to go ahead and start our discussion today. So you may be familiar with the way that I did this this year. We started with political series. So since I had so many different guests, I thought it would be a good platform for us to get to know all of our state officials. And since the election is coming, I thought this would be a good way to also voice out our issues, as you are always there for us.
Thank you.
And already know many of the issues that we are going through, and that's where we are today. So it's great to have you again. Now, I made a couple changes as we go, and now as you get to know me, and you probably know this, so we always make some improvements and changes in time. And before the events, just to make the events a little bit more dynamic, I post surveys, and then this time I did the second time actually time around.
Excellent.
And we ask people instead of just picking the topics randomly, we want people to answer and then see if we can actually address some of those concerns. So the question was, what do you believe are the most pressing issues facing Delaware today? So I had to, because Twitter gives you only 4 options for the answer. So I pre-screened them, and economy, education system, healthcare, and public safety and crime were 4 options. And not surprisingly, economy was number 1 concern, and public safety and crime was number 2. Healthcare was number 3, which I thought healthcare would be number 2, honestly. And then education system was number 4 in this short list. Now, time to time, we discuss this, and I always kind of make some analogies between my job as a CEO of a corporation and the governor's job as the CEO of the state. So there are a lot of similarities, and one, as we can see, one of the challenging and one of the success measure, number 1 probably is the economy. This is true for the companies as well, so we have to be financially viable. So economies are number 1 concern, and we would like to hear what you have to say for the future. Now, one other thing is, because you are also, this is your second term as a lieutenant governor.
Yes.
So with the current situation that we are going through and how we are going to actually see a better economy, so we would like to know your plans.
Well, great. Well, thank you so much for having me. And as a nurse, research scientist, data-driven person, I like the fact that you did a survey. Thank you for that. And I'm not surprised with the ranking that you found. I spent a lot of time not only working with professional leaders such as yourself, but also everyday Delawareans. And the economy and food on the table, good paying jobs, top priority. As I have worked with Governor Carney in the administration, although I am independently certainly elected, making sure Delaware is competitive is critical. I will tell you, as I run for governor and as the next leader, hopefully the second female nurse governor, I am really committed to make Delaware the best place to live, work, and raise a family. And how are we going to do that is starting with the economy, really critical that we have the economics, in place, whether it's making sure we have the best tax credits and incentives to have young adults when they graduate high school or career, stay here in the workforce. And, serving on the National Innovation Manufacturing Biopharma Board as the voting member of NIMBLE, we have to make sure we are competitive in an entrepreneur experience around financial technology, around biopharm, bioengineering, and good old manufacturing, making sure we have those jobs. And finally, your field, the healthcare field. Absolutely paramount from a STEM, science, technology, engineering, math, healthcare, absolutely critical, especially with our aging population and the demands in our workforce of those you work with, our physicians and our other health providers. Oops. Uh-oh, I don't hear you now.
Sorry, I was on mute. So,
oh, okay.
So, now, of course, because I know you, maybe I will be a little bit biased, but I think I'm allowed to be.
Okay.
But your expertise in healthcare, in social issues, in behavioral health, you have done so many different projects, and you did so much for that community. And also, as you mentioned, being a nurse, being a scientist, I believe you are a PhD, right?
Yes.
And also being an educator. And the last 7 years, I believe, economy and crime issues in the state, I think just being on the job, I think you already become an expert. So this puts a different responsibility on you because the expectation is much higher. And I personally believe that you are going to be the next governor of state of Delaware.
Thank you.
So with all these, I think we can maybe get into the public safety and crime. And just from the overall, Delaware has some areas which needs more attention than the others, especially in downtown Wilmington. As you know, we just have a new office. Well, actually, I said but you may not. You probably saw the signs. Right in downtown 600 Delaware Avenue is one of my new primary care offices.
Great.
So you know the building because everyone knows that building. It's kind of like the center. It's the heart of downtown.
Yes,
It's
it is.
little building, but it's right in the it's in the right place. And we are going to have close to 9-10 different primary care and some other specialists in that office. And it's, issue of public safety and crime is always on our agenda. We are always on an alert. Like, for example, our offices are not locked in Bexwoods, but in downtown, they have to kind of ring the bell so that we can let them in. So how are you going to approach the public safety and crime issue?
That's such an important topic, like you said, and thank you for your vote of confidence and support as I, hope to become, like you said, the second female governor and governor. But, public safety is a huge issue. From the time I was a member of the House and Senate, 15 years there, spent a lot of time. The data are really relevant. We have certainly made some improvements in our inner city, whether it be Wilmington, Dover, and our Sussex community. I get to collaborate closely with our current Attorney General and our previous Attorney General as well, working on public health issues. Crime and safety is a public health issue. And I come at that as a population health nurse. Spend a lot of time on the streets, undercover lieutenant governor. And what I see are a lot of social determinants along with traditional justice law enforcement measures. So I'm not going to sit here and talk in detail on law enforcement measures, but we know what those are, making sure that the state resources are there for state police filtered to our counties, to our municipalities, such that there is a vibrant and sufficient law enforcement community, and that there are tools in place that are necessary for community protection. Common sense gun laws, making sure that we have preventative measures in our community. So I'm not going to go into the weeds there, but from a public health perspective, I have lived, and I will later today, I'm reviewing the Board of Pardons list of persons wanting second chances. And I can tell you, chairing the Board of Pardons, I see where I will not only make sure we have the resources for public safety, and we're going to have to make sure that we have a public safety workforce that is one in which is responsive and accountable to the community. We know with the General Assembly and our governor signed laws last year, making sure that there were reform measures in place with accountability with law enforcement. No one should be hurt at the hands of those who are to take care of them, whether a police officer, a nurse, a doctor. We know that. And so we have to make sure we have communication between our state and our community, our law enforcement. Having said that, prevention, when I'm sitting on the Board of Pardons, I've reformed that. I worked really hard to change the Board of Pardons with the team that's there, with others, such that people get second chances. What I have observed, Kemal, is amazing. Like your employees who work in behavioral health, mental health, it is amazing. Around 80% of the people who come before me have some type of mental health or substance use disorder. And those are things we could prevent in a number of persons. Not all things are preventable, but if we start at an early age. And that's why hopefully as we have a conversation today, a lot of the things we do in housing, in social determinants such as early education, birth to 5 universal childcare, critical to me, will help do preventative measures for trauma and what they call acquired childhood ACEs, and we have to lean in. So I'm not going to just be a governor who puts money only toward traditional law enforcement. I am a governor that will work collectively with communities, individualize needs, make sure we have prevention through opioid abatement. I do a lot of work there with our Attorney General. A lot of things are linked to substance use, crime, drugs, and a lack of equal opportunity. So equity into our Black and Brown communities are absolutely important. And one of those key steps is birth to 5, early education, or having universal childcare. It will make a difference. I can tell you, having reformed the Board of Pardons, that most of the people who've come before us have an issue that has started in childhood.
So the crime and public safety, I can't really help but think about gun control discussions. And this is where I kind of like, I don't know if I'm kind of in the middle. So I have 2 or 3,
right.
And therefore safety reasons. I leave my office late, and sometimes I may be the last person or one of the last people leaving. And people know where we are. The house where I live is close to downtown. It says it's the sense of safety, but I don't have this issue of well, government is out there to take our guns away. So can we kind of clear that and then see what your position on this gun control issue? Are we really out there to take people's, are you going to take my guns away? Number one.
No, I didn't mean to cut you off. No, Second Amendment rights are really important. I was raised on a farm in Sussex County and grew up with hunters, and gun safety was really critical and very important. And those things continue. But you are a responsible gun owner. Responsible gun owners, follow the laws. They, register their weapons. They do the background checks. All these things that are just little checkoffs for providing comfort for gun safety. And what breaks my heart is the data are there. I teach population health in the doctoral program. I've been a professor, educator for 30 some years. And I never, ever thought I would see another indicator other than childhood injury causing death in America and Delaware of our children. I always thought it was going to be injuries. Unfortunately, never did I forecast 30 some years ago when I started teaching in this area that it would be guns. Guns are now the #1 reason for child death in our country. And they are a major contributing factor in another population that I work closely with, which is our veterans with PTSD and suicide. And they are a major contributor to our children and adults with suicide, death by gun. And so I've been leading the Governor's Challenge nationally here and for our state with veterans. And so a healthy balance is really important. We certainly respect your right to be a legal gun owner or the hunter to have his and her Second Amendment rights. But what we shouldn't have is this illicit black market. We should have protections in place to protect our families, our children. And I've been a long, long time supporter, one of the few in the Senate back in 2008 or 9 that led a championship around what is known as red flags, which is for persons suffering from severe mental health crises to prevent harm to others or harm to themselves. And so there is a healthy balance to gun safety in our communities. But we really, again, I've been very supportive of our legislature and very supportive of, Moms Demand Action and others who have really taken a role of protecting our families.
Well, that's important. And honestly, getting a gun to me, it was so surprising first time when I had one. It was way too easy. And I thought that was probably part of the issue that we have today, because even if I'm the responsible person and even if I may need it more than the others, I didn't think it should have been that easy.
Right.
So
Right.
I was, as you know, I was born and raised in Turkey, and getting a gun in Turkey it requires a governor's signature. So,
wow.
Yeah. So it's one of the very difficult task to do. So not everyone has it, not everyone can get it. There may be on the other extreme part of it, but I think it was way too easy. I think the issue of making people understand that there's, government is not after anyone's, but it's also government's job to make sure that it is received by people who are healthy mentally, and also from the background check and other things, screening has to be so good so that we are at least pre-screen those problematic issues or people. And I do actually support your position on better control on who's getting it. And hopefully, do you think there will be any changes in the next couple of years in terms of, I know one of our sessions, I learned about the red flag law. Is there a different maybe level of that? So the next level maybe that we don't do, but maybe some other states are doing?
Delaware, there may be modifications. I mean, we've got great members in our General Assembly who have really, assessed this and really want to protect Delaware, whether it was, the ghost guns, whether it was the, registration, purchase permit, whatever level of dialogue that there were put in place. But like you said, in Turkey and other places, different restrictions. I think Delaware has been a leader among many of the states, whether you look at Everytown and Moms Demand Action, we've really been trying to be preventative, gun locks, education. Let's face it, again, when I was a new professor 30 some years ago, never would I thought I would be teaching active shooter drills. I oversee the Medical Reserve Corps. I did for many years. Now I do the emotional best side to that. We now have to prepare, nurses for Stop the Bleed, violent initiatives. Nobody thought about somebody coming into a movie theater or going to our children's schools. It's not good practice. And we have to make sure we put every measure in place to provide public safety, education for families, yet honor the rights of individuals who are responsible gun owners and hunters who do follow the protocols and processes, because we know there is an illicit black market with guns, and nobody should be running around our streets with guns with massive weapons, that are meant for military. That's just a given.
I agree with you on those. Now, Bethany, our next topic is healthcare, and that's probably one of the really important things. Of course, I'm a healthcare professional, so just being in healthcare, this is important. But I know the role of healthcare, and if we do healthcare providers, if we do a better job, not just for the patient perspective, but also population perspective. One of your areas of expertise is public health and population health management. It was one of the goal for us in year 2009 from United Medical ACO. As you know, from the ACO standpoint, from Medicare, MSSP, we were number 1 in the state of Delaware, and we ranked number 17 nationwide. And it took several years to get to this point. So now, because of the patient perspective and the public perspective together, because not everyone who comes to us are patients. So because preventative care is the big part of it, social determinant of health, understanding who we serve, how we serve, what they need, when they need, this becomes more complex. So what is the future of healthcare? And when you are the governor, what are you going to do for healthcare?
Great. Oh, that's a great question. I could talk for 3 hours with you on this topic. Healthcare is a major driving force. Remember during the pandemic, I had a chance to oversee the pandemic resurgence for the state of Delaware with our Secretary of State and working collaboratively with the governor, leading in an emergency, leading in a response. And nothing is more important than your health. A healthy community is a healthy economy, is a healthy education system, is a healthy public safety. So to you at United, number 1, congratulations on being number 1 ACO, number 17 in the country. That is remarkable. And we want to keep that data point continuing, and we want to be supportive. And how I'm going to be supportive of the governor is to really tackle the things that we have to in healthcare, like you indicated, understanding value-based services, looking at the relationship between the insurer, provider, and the frontline worker, and making sure there's access. Right now, we have expanded access we did during COVID by certainly integrating technology. So we have pillars of opportunity. You've got workforce, you've got insurance and payment measures, you have got to make sure that you have the utilization of technology, the utilization of alternative genetic therapies and transition. So we have a lot. I want Delaware to be the number 1 place people live, work, and raise a family. And we have to address healthcare. Healthcare is at an inflection point, and we should be making sure, number 1, people have the access. And in getting the access, if you have quality care, quality providers, quality care, quality will lead to access. And if you've got good quality and you have access, what happens? Your costs go down. Prevention and population health. What you at United Medical have done a great job at, primary care. We've spent some time, whether it was with Senator Townsend and some others, working, leaning in our health committee, Senator McBride and others, also Representative Minor Brown, on the health committee side in the General Assembly, to look at accessibility and payment around primary care. Kudos to you for forming an ACO. You are steps ahead of many when it comes to payment reform, care management. Care management's critical, and getting services early to the population, early to our young adults and others in behavior. And not only physical health, but my work in mental health. The years that we did to fix and work toward the fractured behavioral health, mental health, substance use system in our state. We've worked really hard with our behavioral health consortium. I will commit as governor that healthcare is a top 3 area of focus for me. It will affect our economy, and our workforce is necessary, cradle to grave. You think about our long-term care populations, you think about the need for technology. I sponsored back in the day with Representative Brian Short. I was the health leader in the Senate. He was in the House. Over a decade ago, we did telehealth. We were initially told it would never work, that we had to cap actually the number of visits a client was able to have. And we said, no, we're going to do this. I want to be the leader in this country to think and sit with leaders such as yourself, patients of yours. I learned great things from patients, what they need from pharmacokinetics, what they need from genetics and sparks and gene therapy. We need to, when I say spark is a big genetic therapy research industry. We need to be doing all that we can. Delaware is a hub. I would love to see us to become very aimed high, like a North Carolina research triangle, where we not only have our academic institutions, but our leaders. UD, where I'm a professor, has a #1 physical therapy program in the country. We have the opportunity in this state. So as governor, I will do everything to expand that, including the workforce of having medical education. I worked in Sussex and Kent for 20 years ensuring that we have a medical education program that is continued and broader and expanded. And again, some people like to say, oh, we're going to build a school. We can build a program. I mean, you can expand on Dimer and Dieter, and it can be done. And I know we have plans in Sussex right now, working with BB and Bay Health and Tidal, with partnerships around that. So number one, that expansion, medical education, along with all the allied health providers. So a lot. I told you I could talk for 3 hours on that.
Well, that actually, because that's a really important topic, right? So the one of the statistics that we have, almost 20% of Delaware already, if I'm not mistaken, they're already retired from their jobs, which makes us the 5th in ranking in 2022. Now, based on this, which again makes the, I'm not going to call it elderly, but maybe 55 plus, 65 plus communities, Delaware becomes the main maybe focus for those. We are attracting more people. Part of it is because maybe we are still less expensive than many of other states. It's more affordable.
Yeah.
So having enough, again, many people also don't really understand. And sometimes, like when we go through the patient satisfaction surveys, I see how much there's like not much maybe appreciation for physicians and healthcare providers, because there isn't many of them. So there's a shortage, as you know. And having this type of population, as the population is getting older, that also puts more responsibility on those individuals. So we try to do this better, but I think the cost of healthcare is one of the really big issues. And I do believe, so I'm not going to say I have a dream, but I do have a dream that, if it's possible in any state, I think Delaware would be one of the first ones that we can control the cost of healthcare. Now, even from our own employees' healthcare insurance standpoint, that number is almost 45 to 55% range higher than where it was 5 years ago. So, but I also know that our physicians are not getting paid more. So then that means it's not like physicians are making more money. So that means there's some other systems are maybe taking advantage of this. And I do believe the cost needs to be controlled, especially as we are getting more elderlies, older people. And I know Governor Carney has, with your team, with your help, there's some modeling of capping inpatient hospital cost. Do you believe we are going to see good maybe results of those in the next couple of years under your leadership after 2024?
Great points. You covered quite a few wonderful things. My office led the census for Delaware called the Complete Count in 2020. And we saw those data trends with the elder population. And that's one of the reasons that, I've created and pushed. I've been a big sponsor for community health workers and individuals who can be in the community tapping, working with ACOs, working with our Medicaid population, our dual eligibles, our Medicare and Medicaid populations. Really important. So you've got that piece. But the piece you just were talking about with some things, whether it's capping or benchmarking, I think it's really important to have those direct conversations. We want physicians, nurse practitioners, primary care providers to stay in the market. We don't want everyone going to a concierge provider market. They're being forced to go into that, and we need to make sure the incentives are there, the salary reimbursement, the payment, and the reform while we're making these differences. And I oversaw the retiree Senate Bill 29 this year, which required me to oversee the state retirees Medicare Review Commission, and one of our recommendations that will be coming out, and I'm sharing this with you before the report's out, that will be coming out is going to be a suggestion, particularly in this area, and it will affect not only state retirees, but others, to look around pricing and cost to get a group together through our state employee benefits committee, for which I serve, to do as such. And I do believe, like you said, not so I have a dream, but I do believe that, we might be one of the first states that could indeed be part of this. We've seen some incredible work, both good and bad, because sometimes you make changes, things have unintended consequences. Some good things in Maryland, maybe there's been some unintended consequences in some ways, but other contiguous states. And as governor, one of the things I have led already nationally, the National Lieutenant Governor Association, I work closely with Dr. Governor Josh Green, who's a physician in Hawaii. We are looking at practices and models and what is working in other states. I want Delaware to be an exemplar to other healthcare systems in America. And, whether we are looking at better population health, better wraparound, better pricing, different controls, recruitment, medical and healthcare education, with your leadership and others who are leaders in the industry, I feel really confident. Delaware is the size of a county in other states. We have no reason not to. And particularly, we have a vibrant demography. As a research scientist, many in America, research institutions, funders, utilize Delaware data because we represent America. We have both inner city, we have rural communities, and our demographics for racial breakdown, gender breakdown are really reflective. And we need to be bringing more funds. And as a governor, I want to really make sure we are maximizing the utilization of federal waivers, that we are actually maximizing the utilization of federal partnerships and different opportunities, that I think sometimes because we've just been so busy delivering care and taking care of things immediately in front of us, we haven't had that opportunity. So we got to think bigger, we got to think better, and we got to be bolder when it comes to healthcare. And thanks to the ACO that you lead for having a bold initiative to look at pricing, cost, care management.
Well, thank you. Now, one last thing with healthcare, and I wouldn't feel good if I don't point this out. Obesity is a huge problem, and unfortunately, Delaware is kind of high on the list. And as you know, we do have a program for bariatric surgeries under American Surgery Center, and with CRIAS, Dr. Isaias Ergal, he also does YouTube events with me. We call them Bariatric Fridays. And it started as more like a resource for those patients who are going through the surgery. But then we realized that there are a lot of issues around the morbid obesity, understanding of morbid obesity, and social stigma of it, not recognizing this as a disease, including in some primary care settings. So, but knowing that morbid obesity is the one of the biggest reasons for many of the other chronic illnesses, are we going to see any changes or any new plans to fight morbid obesity from your office?
Great. Oh my gosh. Again, another topic that's been near to my heart. As a House member, 20 years ago, I led and created a chronic disease management task force, which looked at those same kinds of things. And obesity has been a huge issue. We know in Kent and Sussex, almost a third of our population can be classified as obese. Sitting on the State Employee Benefits Committee this year, not only have we been improving bariatric surgery, but we're also looking at the new medications. And certainly, to your listening audience, I know to the providers in the primary care, many of us are concerned. I mean, there's a lot of people right now who are taking some of these meds that are meant for diabetes and maybe aren't being care managed well. We want to make sure that's the case, people are. But diabetes and lifestyle and activity is critical. And that's why a program all the way from prevention in our early education and healthy nutrition programs, absolutely critical, all the way through Love Your Bariatric Fridays, all the way through to bariatric surgery. Yes, absolutely. Obesity, prevention, lifestyle. I lead something Governor Carney created when he was Lieutenant Governor. I took on the Lieutenant Governor's Challenge. I relabeled that Lieutenant Governor's Challenge 2.0. And it has been truly a game changer. We have an awards each year. We just announced our award winners. We had so many great applicants, but it is truly around lifestyle management. It's around, education. It's around systems changes. It's around public policy changes. And again, it's individuals, organizations, nonprofits, community groups who who are coming together and putting together the best practices, many of which focus on weight management, food and nutrition, lifestyle, and obesity prevention.
That's excellent, and I know we'll be able to do more, and there are more potentials from the healthcare provider side. So we'll be there for our people in Delaware and others, and anything that you need from us, we'll be ready to help you with that. Now, our fourth issue on our survey was education. I mean, let me ask you this: like with these four, do you agree with the ranking of those four? Like with the economy being
any kind of ranking, they all kind of blend, but I know jobs and the economy and good paying healthcare are very important, and to me critical. So it's interesting in your ranking, you had public safety sometimes a little bit higher than what I hear with education, but they all go together, right? Social determinants, healthcare. So if you have like a good workforce and a healthy environment, a good thriving economy, people have access to healthcare, right? And then there is often less crime, utilization of substances. Education is a top 3 issue of mine, as well as indicated in your survey. So really important. Now, is there anything you want to focus on in education? Because we can go from early ed all the way to higher ed to lifelong learning.
Sure. So I think the public system, public education, public schools probably is, that's like, I don't have kids, but I hear that from my friends. So many of them, their kids in private schools. Now, and I live one of the next door to one of the private schools here in Wilmington. So, and I always question myself, like, I didn't go to private school because in my time in Turkey, we had a really good public school system, including my college is the oldest university in Turkey. I think this year they celebrate their 160th year anniversary, and it was tough to get in there. So now the new generation of my family, they were all in private schools. And now in Delaware, this is one of the issues that, there's always this between the real estate taxes versus the education system. And then that's like, okay, well, the less money you spend on taxes, more money you spend on public school. Do you think we can change that perception?
Yeah, we have to. Okay, like you, I am public educated. Indian River High School in Sussex County, first generation to go to college in my family, right? And we want every child, regardless of their zip code, to have the world's best class education and the opportunity to choose a career or college. It's what it should be, no matter what your zip code. Absolutely, we have to. We have to change our funding formula in our public schools. Absolutely necessary. We need to make sure that our salaries, Governor Carney and I in the General Assembly raise salaries for our frontline educators in our public schools, public traditional schools, public charter schools. Absolutely, positively critical. And as a mom and a nurse and a mother of a son who had a 504, who had had a lot of disability in learning, I recognize and I understand sometimes parents take an avenue of a traditional school, charter school, private school. I recognize that. But we have to make sure all children, no matter the zip code, get that same access. Changing the funding formula, making sure we pay the brightest teachers to be in the greatest high need schools, absolutely critical. We put our brightest, best nurses often in our critical care in our emergency rooms. We need to be laser focused on our academic paraprofessionals, faculty, teachers, and the resources need to be in the classroom. We need to make sure, and it doesn't end there. We have an obligation, a moral obligation as a society and a government to make sure that our children have the social determinants, have the support systems that they absolutely need after school, through the summer, year round. I work all the time. Some of my favorite, smartest people in the school are my school nurses. They understand families and they know healthcare and they know what needs are needed. So we have to make sure we have the mental health providers, the school nurses, the paraprofessionals, the support services for our children. Every child is born equal. And the one thing I will say that I am committed to, having been a Hunt Fellow, having been the honorary co-chair of Women in STEM nationally, we have to start sooner in Delaware. Other states are providing early education. We can do that without necessarily even raising everyone's taxes. There's ways to do it on different funding streams. Virginia funds it with their marijuana tax. There's little things that are done differently, but early ed is paramount. We have to start sooner. We cannot wait to assume that every child is going to enter kindergarten, first grade the same. We don't have to take resources away from our high schools and our gifted and talented programs. But what we need to do is make sure that 8 to 10 hours, 5 days a week, that every child has an opportunity to have a loving relationship, someone reading to them, teaching them the soonest they can. From 0 to 5, we have 1,825 days. As the next governor, want to work to make sure we have early ed. It is going to be really critical. 90% of the brain development occurs during that period of time. ACEs are formed. It will make a huge difference. So we want people to live, work, and raise a family. Schools are important. They create your next workforce. We want our physicians who graduate from here, from our high schools, to return. We want that. We want our specialists. We want our primary care providers and our nurses to come back. We want them here in Delaware. And we need jobs for Delaware graduates, other programs in place for career opportunities as well. And how we're going to do it is not only having the resources in the classroom, funding formula change, working with teachers, critical. I am an active teacher now. I'm grading papers when I leave here today. I've been teaching actively, consecutively for over 35 years. Yes, it's been in higher ed, but I get it. And I understand why it is so important. And so having a strong education system, having universal childcare, that will affect the economy and it will affect the well-being and the health of our community. So education, important. Didn't go into higher ed. I could talk about higher ed and lifelong learning. Those are really important as well.
I see, I have one comment and one other question related to this. Now, with the public schools, every time, every once in a while, we wonder how we become better people or how we become more efficient to understand the society that we live in. So if kids are in a sheltered schools and then they're kind of isolated from public, then when they go into professional life and start dealing with the reality, then they're always struggling, and they think that life is going to be in their private schools. So then they go through probably a lot of difficulties. They go through depression. They don't like what they see. That not because it's good or bad. It's just because they're not used to. And I think I see the downside of the private school systems because of that. Now, I come from a wealthy family in Turkey, but my classmates, I had, because it's one of the most difficult schools to get in, we had people from rural areas who were very successful and they were able to get in. And then I saw that first time in college. So if I didn't see that, I wouldn't know that people exist from those backgrounds. And then it would be a lot more difficult to understand these individuals later in life. So that's why I think the schools are the great places to kind of get us ready for real life.
Yes.
And that's why it has to mirror what our demographics is in real life. So my question is, you are part of University of Delaware. You teach at UD right now, right?
Yes, I do. Yeah.
And my question is related to UD. UD is one of the greatest universities in the United States. Overall ranking is 76. In public universities is 36, I believe. So do we really take advantage of this really great university we have, especially with, I'm going to tie that into the healthcare topic too. So I always thought that UD would be a great place to start a medical school. So do you think we are going to see one, medical school in Delaware, and two, are we really taking advantage of university like UD being in Delaware?
I think that's a wonderful question. And it's something when I was first in the House and Governor Minner, first female governor, took office, we actually had a study with some of his providers and hospital services out of Philadelphia and Pennsylvania about building a school. And what we have found, we absolutely need to have medical education. We have to have a medical school program, whether it's an integrated hybrid model online, expanded services, whether it's through a partnership with Tidal and BB Bay Health in Maryland, whether we expand our DIMER, Delaware Medical Education Program with Jefferson and PCOM, or if BB and Tidal are going to work more with PCOM. There are studies going on now. I've been part of those conversations, and all of our higher education institutions should be included, not only University of Delaware, but our HBCU, Del State, and the Hornets need to be part of that. And certainly we always include also our private entities as well, which is nice to have our private hospital, our hot universities. But for as University of Delaware is concerned, I know our current president, our past dean, Kathy Matt, that I worked with, we've sat at the table, and former Secretary of Health, Rita Landgraf. We've all been part of a group that have been working toward looking at best practices. We need to ensure that we have medical education expansion. And again, whether it be toward a partnership or building up the school, construction of a new school, the accreditation and the other processes, that takes a little longer, a little more complicated. But I can tell you this much, I am committed as a governor to make sure we have the medical education expansion, the resources, whether it's a partnership school, a hybrid model, we have to have that. And we have to also have some sort of continuance of expansion of all of our allied health providers, as well as our frontline technicians and our first responders, in the community. So it takes it all. It takes the entire system. I oversee, like I said before, disaster preparedness. One strength I have as the next governor will be that I have spent almost 30 years in the field of understanding disaster response and preparedness. Whether a hurricane, whether shootings, whether a disaster, whether a pandemic, one has to be nimble, one has to be quick, one has to be ready. And that is something in the health field that Delaware has done a decent job. We can continue to do better. And so having those academic partnerships, the resources, the critical pieces, that will all filter in and really make Delaware stronger. And it fits into, priority of mine to, really make Delaware the best place to live, work, and raise a family. And as a nurse, I have to say, from all as a nurse, you give us a job, we get it done. And I want to be the next governor of Delaware, and I want to be actually the first nurse governor ever in America. So when and if elected, I will be the first nurse ever to be a governor.
Excellent. So, this what you see on the third screen is this is my A team.
Your ladies.
As you are the head of the governor, I see Kyle Evans-Gay as our lieutenant governor, and our senator is going to be, I believe, Lisa Rochester, who's going to be our guest next week. And also the amazing Sarah McBride is going to be next Congresswoman. And I'm so excited to see a picture like that in Delaware. So we are going to trust, and I know we'll be fine with all these four amazing women who are representing us. You're an amazing person, amazing leader. And it's my privilege to be your friend, and also being able to work with you in different issues that you may need us. And I know it's going to be a challenging time. So my last two final questions. One is, if I don't ask, I'm going to be blamed by my own people, this electric car issue. So I know there's a new, the electric cars.
Yes.
The new law with the, Sean is going to be upset if I don't ask this question because
Okay, gotcha.
So now, is it going to be viable really in the next several years that we'll definitely be 100% electric? Do we have the right infrastructure for that? Is it real? Is it realistic? Should expect that?
What a great question. I mean, oh my gosh, electric vehicles, clean energy, what is the future of the economy, right? Jobs and workforce, etc. But there's a sense of reality. Those of us, I spend time in the community. I'm mostly in high-risk communities with vulnerable populations, and individuals who have affordability issues. EVs, there's been a recent change in perspective and somewhat what was rolled out. You saw there was a little room given. We have to. We don't have all the infrastructure yet. We're going to have it. We're going to have it at some point. It may not be in that shorter window of time, but over the period of time. And we have to make sure that we move in those directions, not only from a environment perspective, a health perspective, But again, from the overall economy and in the world oil and the supplies and the energy, we are moving there. We need to ensure we have the infrastructure, and we need to make sure people can have the affordability working with our dealerships. So I am sure we're going to get there. Will be a slightly a different modified timeline, because obviously, I have an electric vehicle. We're around Middletown. It's not a Tesla. There's not even a place around to yet plug in, but there will be. So I think we have to kind of like pace ourselves and have good goals and really move in those clean energy environment direction.
Well, I think Sean is young enough so that he has still time to warm up to that. So I'm going to buy him a Cybertruck. So I think he's going to like that. So now my last question, and that's how we can close with that. Now we have primaries you are going to face with Matt Meyer for that in September. And what I believe is not going to be important in this because Delaware is going to decide. But how are you differ from Matt Myers, and what's going to make you to win this primary so that I know that you'll be our next governor?
Oh, thank you. I've been through primaries before, and the nice thing is the day after, we all have to work together and get along, because that's what I'm about, building consensus. I am extremely uniquely qualified, having been not only in the legislature, but being second in command of our state already for over 7 years. I am ready on day one and will not need any on-the-job training, and know how to execute, how to lead, how to govern, not only in the legislative branch and with my incredible colleagues that I so greatly appreciate. As of today, have 15 legislators who've endorsed me, and I have 16 labor groups that are standing behind me in this early period of time, which is really early, and our governor has endorsed me. I don't take those things lightly. But I know I'm ready to the vision to lead, to make sure we're the best place to live, work, and raise a family, and have those qualifications that are necessary to get the good paying jobs here, knowing that what we have across America, having those relationships, and knowing what we need, understanding the health system, which is the major driver, and having been an active currently teaching, currently practicing educator. My real practice, my realism, my ability to be relational, and people are really ready for a second woman governor. And I know that not only is Delaware, but America is really excited about the opportunity to have a nurse governor. So I am just thrilled to have this opportunity to say that I have very unique qualifications and highly qualified, ready on day one, and just so humble. Always a great honor to serve. It's something that I've always done as the daughter of a pastor, is to give unto others, and to care and to give back, and to whom much is given, much is expected. And there's no higher honor than it would be for me to be the next governor of the first state of Delaware.
And I believe with all the expertise and all the right background, from the right background standpoint, I don't see anyone who can be a better candidate than you are. And
thank you. And it's a team effort. We don't get here alone, and we all work together. So the day after the primary, we all have to work together with one goal of making Delaware strong and healthy and the best place to be.
Well, you are going to be fine, and I know we'll have other discussions later on in 2024, and we'll make reference to this this episode. And again, Lieutenant Governor Bethany Hall-Long, thank you so much for joining us.
Thank you so much. I've enjoyed it. Thank you so much. Great. Thank you.
All right, so we had Lieutenant Governor of Delaware, Bethany Hall-Long, this week's guest. Next week, we'll be back with Lisa Rochester. She's our Congresswoman this time, and then she's running for the senator position, U.S. Senate position, and she'll be with us next week. Now, we are running a little bit late for our Bariatric Friday, and I'll be back in 2 minutes with Dr. Erkan on Bariatric Friday. Thank you so much. Bye-bye.